When we were talking about the common symptoms of mental health disorders, we talked about sleep disorders, sleep disturbances. Let's talk more about sleep disturbances, a very common symptom. But those disturbances may at some moment turn into a disease, the famous sleep disorders. Sleep disorders are very common. How can we detect that something is progressing from to become a disorder at a certain point, from a symptom to a disorder? To begin with, how do we detect sleep disorders when we're not able to fall asleep rapidly after going to bed at night at the usual time, or when we wake up in the middle of the night, not being able to go back to sleep, or when we sleep the full night and at the beginning of the next day we don't feel we have rested well enough? And other things may also begin happening, like not being able to memorize properly, use your attention properly. Even motor skills can be affected by sleep disorders. We have to keep in mind that this very common symptom, the disturbances of sleep that lead to think that you may be having a mental health problem, can turn into a disease, into a disorder itself.